the most dangerous and powerful horned snake in the world. Information about the legendary horned snake. Horned snake or horned viper. Scientific name: Cerastes, is a genus of reptiles that belong to the viper family within the order Squamousidae. Currently, this genus has 3 species according to the Taxonomic Information System. Some species have also been recently described by the Reptile Database. It is a poisonous snake. Horned snake is small, relatively thick with a short tail. It can grow to a maximum of about 0.90 meters, and the head is broad and flat and covered with small scales. Almost triangular when viewed from above, the snout is very short and wide, the eyes are small to medium in size. Prominent, set to the side of the head and well presented, with an oval head, and the seams directed upwards. There is usually a long horn above each eye consisting of 1 scale. Specimens have this horn-like scale on a prominent forehead rim. The dorsal scales have pits, highly spurs, and laterally large and smaller vertebrae, slanted with serrated pieces. It is also a heavy, slow-moving nocturnal snake that uses sideways movement on soft sand and hard surfaces. Buried sediments often lie in the sand with only the eyes and nose exposed, and sometimes shelters in rodent burrows. If she is disturbed, she assumes the position of the coil in an S shape and rubs the sides of the body together in a rough and loud voice, very nervous, irritable, and aggressive in disposition. And do not try to escape, preferably taking refuge in the burrows of rodents or lizards or under grass, dirt or flat rocks. Common names: horned snake, desert snake, African desert horned snake, Egyptian sand snake, desert horned snake, desert sand snake, pink desert snake.
As for the local names for the snake of Abul Qarn, they are Lafa, Lafa Kabir, Lafa ibn Quran, Shayahira, Hayabakoran, Zeus, Tashlot, Kinmertu, Janab, Ram, the modesty of Bagurun, the modesty of the centuries, the mountain neighborhood, Abu Quran, al Qarun, Rabu Spiskaran. Locations of the horned snake is found in the Middle East, North Africa, Algeria, Chad, Egypt, Iran, Iraq, Israel, Jordan, Lebanon, and Libya, Mali, Morocco, Niger, Oman, Saudi Arabia, Sudan, Tunisia, United Arab Emirates, Yemen, Mauritania, and Western Sahara. Home of the horned snake. It lives in the sand about 1,500 meters under the sand, including sand dunes, and rocky hills desert, and feeds on small rodents. It will eat lizards, small birds and sometimes small snakes. The average poison of the horned snake between 40 to 70 milligrams. Symptoms of poison entering the human body are not specific, but may include headache, nausea, vomiting, abdominal pain, diarrhea, dizziness, collapse or convulsions, and it may reach nerve paralysis. Behavior and reproduction in winter: from November to April, the snake hibernates. Where wild rats enter the burrows and remain in hibernation, the beginning of the 4th month, she begins to go out to be exposed to the sun to restore her vitality. Where the skin is then flayed, and as soon as it regains its vitality, the mating season begins. Female lays 10 to 20 eggs in damp places under the bushes. The eggs hatch after 8 weeks, and the young reach the reproductive age after 2 years. And carna snake lives 18 years. Species it has 3 types in circulation so far: running snake couple or viper snake. First aid for snake bites. The injured person must be reassured and persuaded to lie down and remain still, and many will be terrified, because the patient will be in a state of hysteria, for fear of sudden death. In this mood, they may be rational, and the basis for reassurance is the fact that many venomous bites do not lead to harmony, the relatively slow progression of severe venules, and the efficacy of modern medical treatment. The bite wound should not be tampered with in any way, and wiping it once with a damp cloth to remove surface poison illegally is very harmful, but the wound should not be massaged. If there is any disruption of vital functions, such as problems of breathing, airway, blood circulation, heart function, it should be supported as a priority, and in particular, stings that cause flaccid paralysis, including respiratory paralysis, both the airways and breathing may become impaired, which requires urgent and long-term treatment, which may include an oral technique of masking, mouth, to move expired air, and urgent medical attention should be sought. Or do not use flush, cut, absorb or loosen the wound, or apply chemicals or electric shock. 5. Avoid taking sedatives outside the hospital, and if there is a delay in the case before reaching medical aid, measure over several hours to days, then give clear fluids by mouth to prevent dehydration. 6. And if the offending snake is killed, it must be brought with the patient for identification, but be careful to avoid touching the head. Even a dead snake can be poisonous. Today's video has ended. We hope that you will be satisfied with the information we provided about the legendary horned snake. Goodbye, friends.